a team of engineers at Drexel University may have just taken a major step toward changing how we treat both leg and life threatening diseases. They've developed tiny robotic tools called micro swimmers. Now, think of them as microscopic helpers, smaller than a grain of dust that can travel through the bloodstream. Their goal is simple, but I would call it revolutionary: find plaque and help remove it. These micro swimmers are made from tiny iron oxide beads linked together into a corkscrew shape inspired by the way certain bacteria move throughout the body. Now, once inside the bloodstream, doctors can actually steer them using an external magnetic field. By adjusting the strength and the direction of that field, they can guide the micro swimmers straight to a blockage. How fun would that be? Now,
I
when
mean,
they arrive,
totally.
the spinning motion, the spinning motion that they have helps to loosen the plaque. And then through a minimally invasive catheter, something Dr. A is very familiar with, a micro scale drill clears out the debris. But here's the remarkable part, I think. Once the job is done, the biodegradable beads release anticoagulant medication right at the treatment site, helping to prevent new plaque from forming. Now, it's still in the early stages of research, but this technology, I think, does hint at a future where clearing arteries could become less and less invasive, more precise, and far safer for patients. So, Dr. A, from a clinical standpoint, how realistic do you think it is that micro robots or these micro swimmers could one day be used inside human arteries? And do you see any major scientific hurdles, safety hurdles, especially with that?
Oh yeah, absolutely. I think the concept is extraordinary. It's very noble in its approach. I think we're not completely there yet, and with the new wave of people's dietary changes and the consciousness of their health in general, I think in the future, by the time these nano robots are out there available, it's going to be limited to a small portion of our population because most people are going to be healthier and will not have peripheral artery disease like we see it now. What I do see as a problem is the primary hurdles for these nanobots are going to be the biocompatibility, of course, the possibility of distal embolization, which is an issue, and the having systems that reliably retrieve these after they're done doing their job. Also, we have to make sure that these nanobots do not cause more damage while they're in there. So I think it's the concept is fascinating. It's sci-fi at its best, but I think we're still far away from that. And by the time that technology really becomes developed and it's approved by the FDA, I think you're going to start seeing a new wave of people treating their bodies differently than we have seen in the past. I think the baby boomers and Gen Xers are probably going to be the last ones to see P.A.D. the way we see it. I see the new generations, millennials, and going forward, they're not going to have that type of issues. We're going to have other types of issues, but not associated to atherosclerosis in that manner.
Oh, wow. That is really encouraging. You just see the younger generation eating a lot healthier. I mean, and we're going through a big wave of changes right now, just starting with awareness of the ultra processed foods and the impact on our bodies. And you even have, I think he's the attorney general in San Francisco,
Uh-huh.
that is going after a couple of the manufacturers, right, of ultra processed foods and saying, hey, stop hiding crap inside these products, start using real things. And the funny thing is, I see that in my X feed. And then right after that is the new Oreo, zero sugar Oreo that has even more ingredients in there that you can't even recognize. So
No, it is.
hopefully,
It's amazing. I think we're really cognizant about, consuming products that don't have preservatives and things that are affecting us directly and indirectly. The use of these apps and artificial intelligence is now aiding in selecting our
yeah,
foods and that we're more discriminative of what's on the shelf. I mean, I find myself in the grocery store using my Yuka app, checking absolutely every product
yep.
that I go through. and
I love
selecting the
that
stuff
out.
that's healthier for you, avoiding all those biohazard substances that I don't want in my body. But I've got cravings for these delicious things that I used to enjoy as a kid, and now I can't take them because I'm conscious of what is in them. And I know the uh, the target now is to age slowly or even reverse your aging, and so you don't want to put any pollutants into your body that's going to make you age quicker.
Nope. So with these nanobots, how do you see them fitting in? I mean, for those people that we will need, that will still need a little roto-radiance, will still need their arteries cleaned out. Do you see these nanobots as a potential replacement for our standard angioplasty and stenting processes?
I think it's hard to say. I mean, this is a microscopic technology that it's so intricate and so sophisticated.
Yeah.
Um, as a vascular surgeon in the open realm and endovascular realm, it's kind of hard for me to envision these nanobots going through there, like what we see in some cartoon animations. But it's completely possible. I think technology is advancing at enormous strides, and I think that the possibility of this in the future exists, and perhaps the technology will be developed in the next decade or so. That's the challenge, is the timing, and that's why I said, by the time these things get developed, are we going to have that type of disease? Um, but it's fascinating because having this micro technology, you can deliver, like you said, drugs directly to the site and remove debris and recanalize vessels that have been completely occluded. I mean, the concept is noble. I think it's depends on what the trials show.
I'm also wondering, it was mentioning that it was going to include an anticoagulant in there to prevent, what I would imagine they're talking about is restenosis. But I would think that one of the cancer drugs, the chemo drugs that are already used on several devices, the drug eluting stents and the balloons, I would think that those would be more fitting in this type of situation. Or am I wrong?
No, no, you're totally right. I think that your perspective is right on the dot. I mean, it's what's in vogue now. It's what's available to us in these times. It's great to have this technology. I think there's going to be a utility for it, down the road for other pathologies that perhaps we're going to encounter, such as cerebral embolizations, and where you need, more intricate work, where these nanobots can be successful going into the brain and clearing vessels in the brain, so that precious CPU can continue to be preserved and flow goes through there.
And you mentioned a little bit ago about a concern with potential for distal embolization, but do you have any other concerns about navigating these devices inside real diseased vessels, especially in
I,
patients that have complex plaque calcification?
No, absolutely. I think there's just it's complex. There's fibrous material,
Yeah.
there's thrombus. I mean, there's just so many things. But because these things are so tiny and small, I'm sure they can navigate through there without any difficulty. But the question is, what technology is going to drive them? What's the engine? I mean,
Delivery.
it's just
Yeah.
unbelievable. It's incredible. Just to imagine and envision these little nanobots doing these incredible
Right.
things. Yeah, it's fascinating.
I would be worried that these nanobots might go rogue and eat through the vessel wall or something and perforate. That
Well, I
would be
think
a
they're going to be
concern.
designed
You
in a
never
way
know.
that, well, I think that there's going to be algorithms that are going to be, these things are going to be programmed. These
Yep.
little artificial intelligence is going to be driving these things, through these vessels and remodeling these vessels, just like our bodies do, just like our cells go in there, and macrophages that go and they're scavengers and they remove debris and clear things up. I mean, they're just going to make it more efficient, and it's going to be a great adjunct to the human, body, I guess.